I'll start from the beginning. It's a good place to start, right? I found out I had HIV/AIDS in New Orleans in the summer of '86 when I went to the health department for chlamydia. They gave me a shot in the butt and gave me some pills to take, and they said, oh, by the way, would you like to take an HIV/AIDS test? I'm like, sure, why not? It's free. So about a week, maybe 2, probably 3 weeks later, I get a postcard in the mail saying I need to contact the health department. I go back in, and there was a young black girl in the office, and when she walked in, I looked in her face, and I seen that her eyes were welling up with water and tears, and immediately I knew that the results of my HIV/AIDS test was positive. So she starts crying, and I start crying, and she hugs me, and she asked me about follow-ups, but I just needed time to think. You know, it felt like somebody had snatched the world from underneath my feet, and I was falling. I was falling when I found out. You have AIDS? It means you're dying. Or at least that's the sentence I thought I had. But it's not a death sentence anymore. I mean, don't get me wrong. It's not easy having AIDS, but the medications are a lot better than when we were taking AZT. I mean, it's nicer now. I started taking AZT in the early '90s, and it was awful. I mean, it was really awful. So awful that I got off of it until about '97, and that's when I had to leave work. I remember my manager had dropped me off on a Friday, expecting me to be back at work on a Monday. But to everyone's surprise, I didn't go back to work for another 18 months. During that time, I lost a lot of weight, and I remember I was living in the Gray Street apartments on the 3rd floor. And when I had a doctor's appointment, my nephew would have to carry me down 3 flights of steps and put me in the car. He would drive me to the Wings Clinic, and he would put me in a wheelchair and roll me around, and after my appointment, he would put me back in the car, and he would carry me back up 3 flights of steps. And that's when I had to get back on my medication. And I haven't missed a dose. I can't afford to miss my medication. I can remember all those years ago, there was a white kid in the clinic, and he was talking to his friends and other people in the clinic, and he said, I'll take my medicine when I think about it. I was so angry, I just wanted to slap him. When you think about it, do you think to take your next breath, or the breath after that, or the breath you're gonna take after that? That's how you have to be with your medication. You have to take it religiously. No ifs, ands, or buts about it. Knowing the potential outcome of this disease has kept me very engaged in my HIV care. I remember I had a friend before she passed, she said, they're gonna find a cure for AIDS. And I said, no, they're not. Or at least if they have one, they haven't shared it with us, but the medications are better. You know, getting to the point where I can talk to people about having HIV/AIDS, it was a struggle because I didn't want to be around all those strange people. You know, I didn't mind talking to the doctors or those who were going to prescribe my medication, but all those other people in my life, I didn't owe them anything. You know, it used to be, oh, you have AIDS. Now I'm like, you know, AIDS, HIV, yeah, so what? Positive. I don't care, it doesn't bother me any. I wear a t-shirt that says positive. That's who I am, and I own it. You know, when you get older, you tend not to care what people think about you. And I'm older now than I ever thought I'd be. But my mom, she shared with me. She shared that some of her girlfriends who are Jehovah's Witnesses asked, you're going to see about your son because he's sick. What's wrong with him? And she told me that she told them that I had cancer. When she knows that I have AIDS. You see how the stigma goes? You know, and I'm not making fun of her, I'm not. But for her to tell someone that I have cancer when she knows that I have AIDS, my mom couldn't even tell someone in California that I had AIDS. She told them I had cancer. That's why she was coming back home. Now, how messed up is that? HIV and AIDS should be just as comfortable as talking about high blood pressure or whatever ailment you have. You know, when I did feel the stigma and the shame, I knew that I was wasting way too much energy on negativity. I was wasting way too much energy trying to keep this person from knowing and try to hide it from this person and make sure that this group didn't know. That's too much energy wasted. And why? You know, if they wanted to spend time on it, that's them. But me, I just said, forget all that. You know, to deal with it all, I go to support groups and I garden and I cook. You know, I like a cocktail or two at night. You know, I like 100 proof bourbon or 100 proof vodka. I make my coffee, I smoke my pot, and I watch the train go by. I've got my dog, I've got my porch, and I am loving life.